Good morning, and I hope everybody had a good weekend, and to all of the fathers, a belated happy Father's Day. I want to thank everybody for being here today. Then before we get started with our formal announcement, which is a very exciting announcement, I want to take this opportunity to recognize our cabinet secretaries and other folks that work in our administration. You see them behind me. They're one of the most diverse cabinets that Virginia has ever seen, and also they're some of the most talented and hard-working individuals that I have ever been around. And so on behalf of the Commonwealth of Virginia, I just want to say thank you to all of our secretaries for all the work that you've done over the certainly years, but especially this last year, which has been difficult for everybody. And they have really worked hard to keep Virginians safe and allow them to continue the lives that they're used to living. So thanks to all of the cabinet members. We are here today to celebrate truly a great milestone for the Commonwealth. As most of you know, back in early May, President Joe Biden set this country a goal, getting 70% of American adults at least one shot of COVID vaccine by July the 4th. And we knew that Virginia could meet this challenge. We've met many other challenges, but today I'm standing here with these folks behind me that have been so much a part of this, proud to say that we have not only met that goal, we have beaten it. Virginia is the 16th state to have 70% of adults with at least one shot, and we've reached it 2 weeks early. And 60%, I'll repeat that, 60% of adults are fully vaccinated. I am grateful again to everyone who has worked hard toward that goal for all these months, and to all Virginians, more than 4.9 million of you who have had at least that first shot. As you all know, the vaccines are our way out of this pandemic and back to a more normal life. But it requires all of us to do our part, just like we have done throughout the pandemic. People are getting vaccinated to protect themselves, but also it protects their families and neighbors. We have seen in real time the effect the vaccines have. Our case numbers are the lowest they've been since the early days of the pandemic. So are our hospitalizations and our deaths. Our percent positivity has dropped dramatically to less than 1.5%. The vaccines did this. They and everyone who worked and continues to work to get them into arms. We started the vaccine rollout, believe it or not, a half a year ago with our most vulnerable people in nursing homes. We moved on to large mass vaccination clinics like the ones at the Richmond Raceway. But we knew that to reach the president's goal, we couldn't just rely on people to come to big events, taking time off work, finding transportation, or childcare. We needed to meet people where they live. We needed to bring the vaccines into communities. So we expanded our outreach to local pharmacies and grocery stores like Hope Pharmacy right here in the 25th Street Market. This market is a lifeline for folks in this neighborhood to get the basic necessities. And the pharmacy has been a tremendous partner in vaccinating people. This is a community market, serving the people who live and work here and providing answers and reassurance about the vaccines. I want to thank Dr. Chantel Brown, who operates this pharmacy, and Mr. Norm Gold, manager of the 25th Street Market. You are providing a vital service for your community. It really does make a difference in people's lives. And before I ask Dr. Brown to speak, I also want to again thank you, my fellow Virginians. Every person who has stepped up and gotten your shot, you have made yourself and your neighbors safer. You have allowed us to get back toward a more normal life. You have made a difference. And for anyone who still has not gotten vaccinated, please do it. We have 3 safe and effective vaccines, and everyone 12 and over is eligible. Please get that shot for yourself and for your family. It will save your life. We still have people in hospitals with COVID and in ICUs on ventilators. We still have deaths, unfortunately, every day, but it doesn't have to be that way. So we are thrilled to reach 70%, but we want to get as close to 100% as possible. So please get out there and get your shot. And before I introduce Dr. Brown, one of the things that I have realized traveling around this great Commonwealth, and I am biased, but we live in the greatest state in the greatest country in the world. But what this pandemic has done is really brought out the good in people. And I have seen it all across Virginia as I've gone to vaccination centers, testing centers. People are literally, the volunteers, VDEM, the Virginia Health Department, our Virginia National Guard, all of these individuals are good people. And this has brought out the good in them. So again, on behalf of Virginia, I want to say thank you to all of you that have been part of the solution, part of the village that it takes to keep Virginia safe and healthy. So please welcome someone who is a community leader. She runs the pharmacy here, the Hope Pharmacy, which has just reached out and touched so many lives, Dr. Chantel Brown. Dr. Brown, thank you.
Good morning. Helping others physically prosper every day. That is our vision for this community. And one of the ways we accomplish this is through the education of vaccinations. Who knew that 2 years ago they would have such an impact on this community? But they have. A major way. I'm thankful that we've had access to the vaccine, that we've been able to provide the service that our community needs. I have to thank Dr. Avula and his team, Ms. Amy Popovich and Ms. Whitney Tidwell, who were instrumental in making sure that we received as much vaccine as we needed in order to serve this community. Even until this day, we still have people every day that come up, at least even if it's 1 or 2 who aren't scheduled, who have finally decided that it's time for me to be vaccinated. And so we just get them in so that we can give them what they need. I also want to thank Mr. Norman Gold, the developer of this store, and Mr. Stephen Markell, the owner, who both have been instrumental in making sure they open up the community room. Anything that we need to have access to, they have given it to us. And I can't say enough about Mr. Ukrops. He still to this day, I worked for him many years ago, and I never knew how much of an impact he would still have on my life today. But he has been monumental in having things work for us and working for us and making sure that we can provide the services that we need for the community. He's a great advocate and facilitator. I can't go without thanking my staff who are here with me every day. They're working, but Sierra Johnson, Sakeem Winston, Donna Lisa, who fills in for me as a pharmacist when I can't, and she was actually my first student, so it's an honor to have her come in and help me during this time. Brianna, a VCU student, and Tracy Turpin, who is about to go to hopefully pharmacy school. She's thinking on that track, but we hope we can persuade her just a smidge. My pharmacy peers, it's not just Hope Pharmacy helping others throughout the community, but there are pharmacies across all of the communities in Richmond and Virginia who've been able to help. My family, of course, I can't say enough, my mother and my siblings, and my kids, who, when we're not at home, when we're working, they have taken a brunt for most, but I'm just thankful for them, Morgan, Kendall, and Trey. And to the best spouse on this side of creation, I call him Mr. Hope, as so many others do. The best supporter and encourager. As you know, owning your own business is not always easy, but he has stepped up and led the way and given me that encouragement and support that I need. So I am thankful for him. As well as my volunteers. I can't say enough about my volunteers, from VCU students to all the disciplines, as well as to now MRC, who've been helping as well while our kids are still off on their summer vacation. So I'm thankful for you, and I look forward to working more with the community, especially as we vaccinate our children. That is a pivotal point, a part of what we need to do going forward. I know all of my kids, all three, are under 12. And so we are waiting for that day when it's time for them to be vaccinated. Thank you so much.
Good morning. Welcome to the Market of 25th, and most importantly, the Hope Pharmacy. Thank you, Governor Northam and Dr. Avula, for your amazing leadership. It was your guidance that helped us become vigilant to support the health and safety of the community. And most importantly, our role has been to support Dr. Brown to get the vaccines out to the community. Our source is truly to serve Churchill and the East End. And that's why we're here. We're not just a grocery store. We're here to serve the community and everybody in it. And we're proud to be part of this effort. It's really what I wanted to say, but we're really, really proud to be part of serving this community. And with that, I want to introduce Dr. Brown.
Thanks, Norm. Thank you all so much. It has been an incredibly intense 6 months of this vaccine rollout, and I think Dr. Brown can attest to this. You know, there's a time that feels like forever ago, really was probably just a few months, where you were scrambling and couldn't get enough vaccine. We couldn't get enough vaccine coming into the state of Virginia. Every dose was so precious, and I remember you and your team having to put out social media to make sure that those last few doses didn't get wasted, doing everything that the provider needed to do at that point. I mean, it was such an intense period of time. Now the work of providers has changed, right? Now that we have plenty of supply and still more individuals who need to get vaccinated, Dr. Brown and her team are doing a different kind of work where they are reassuring patients, educating patients, helping people understand why they still need to get vaccinated at this point. So really indebted to the work of you and so many other providers. Pharmacists in particular have been amazing contributors to this vaccination effort. If you look at where the vaccines have gone out, pharmacies actually make up the bulk of that. So thank you, thank you, thank you. And it is a day to celebrate for sure, for us to get to 70% with one dose and as the governor said, beat the president's goal, but our work is not done yet. The next few months we'll continue to see disease, hopefully low rates here in the Virginia in the summer, but as we anticipate more in the fall and winter, the work will continue. The work will look different. It will be community. It will be pop-up. But it will take providers like Dr. Brown and so many others to continue working together to get Virginia vaccinated. Thanks so much.
Thanks, Danny. I'll just finish up with very brief comments just to highlight that we would not be at this important point without just incredible teamwork across the Commonwealth, with our pharmacists, with our local emergency managers, with localities, working across state departments and state secretariats. So for me, this pandemic response has really been to see teamwork coming together and having tremendous impact. When leadership sets a goal, we all come together and we all contribute. It's amazing things that can get done. So I congratulate this great example here in this community and just thank our hospital systems, all of the folks that continue to contribute in all aspects of the pandemic response, and especially with the vaccine rollout. So thank you very much, and Governor, I'll turn it back over to you, sir.
Thank you.
I'd be glad if there's a question or two. I don't want to keep everybody out here in the heat too long. Cam?
Just starting with the, I don't know if we're going to press conference, so we'll both out at the same time. But,
One at a time.
All right, so regarding the vaccination rates, I know Dr. O'Toole kind of touched on it, where we're hitting the 70% as a state, still many areas well below that here. Richmond, 52, Prince George counties at 42, I believe, last check. What is this milestone mean for those localities that are still well below sort of that vaccinated?
Yeah, it's a great question, Cam. And there, as we've said, there's still a lot of individuals that we need to reach out to. And we started with the mass vaccination clinics, and they went very well. They served their purpose, but now it's time to take vaccines to the people. And so we're really thinking outside the box, if you will. We're being as creative as we can, getting into the communities. We're using mobile units, as you probably know. Also, we're working with some businesses to provide some incentives for those that still may be on the fence. But the bottom line is that we still need to get more people vaccinated. There's the Delta variant that I think everybody's familiar with, that's from a foreign country, and as long as there are vectors, as long as there are individuals walking around existing that have not been vaccinated, then that's where those variants like to go to live. And so the more people we can get vaccinated, the better. We're going to do that every way we can. As you know, individuals 12 and above now can get vaccinated. We encourage those families to take advantage of this. And then we anticipate, hopefully in the next month or two, the FDA will give approval for 5 and above. And that's certainly important. It's not mandatory that these individuals be vaccinated to get back into the schools, but in order to get our children back safely and responsibly this fall, the more that we can get vaccinated, the better. So we're coming at this from a lot of different angles, getting into the communities, but encourage everybody to take advantage of that. You had a follow-up question.
Yeah, but also, just based on what you said, are you at the point of thinking cash incentives like some other states yet?
No, there will be no cash incentives in Virginia. We just expect people to do the right thing.
All right, and then just the other thing, I know later today.
That's 3 questions, Cam.
2.5. But Senator Stanley, in his role as a lawyer, announcing a lawsuit later today to try and stop SB 971, the banning of skill games going into effect on July 1. Any comment to those efforts?
I work with the legislature on the games of skill. They made it quite clear that after this year, they wanted those to stop in Virginia. I was part of that agreement. I have kept my word, and the legislature, that is still their intention. Obviously, there are some like Senator Stanley that want to move on with that, but that's up to the legislature, and I don't anticipate those moving forward after this year.
Yeah, so obviously with this big milestone, it comes with anxiety for some because the state of emergency is ending, and with that will come the end of certain eviction protections at the state level.
Yes.
And you said recently that you're not planning on extending those through an executive order despite the state housing advocates. Can you explain why, and are you concerned about a flood of eviction?
Well, we are, and there are means for people that are threatened by losing the roofs over their head to continue that. But as far as the state of emergency, Jackie, Virginia's done such a nice job. We've reached 70%. Our numbers have gone way down, and I just didn't see that it could be justified to continue the state of emergency. But we're going to do everything that we can to help people stay in their homes. I hope that landlords will continue to work with them. The mask issue, as you know, is something else. We're working through the details of that. I will give guidance to our law enforcement to not harass or arrest anybody that needs to continue to wear a mask. And then when the legislature comes back to Richmond, the first week of August is what we anticipate, we'll change the code so that it will be lawful to continue to wear a mask.
Can you explain a little bit more about why you thought couldn't be justified? Was it that you didn't think it would, stand up in court, or did the apartment association or
I listen to everybody. I certainly want to be on good legal standing, the decisions we make, but I don't feel that we're still in a state of emergency, Jackie. Our numbers are down. Our positivity rate is 1.5%, and so we need to get back with our lives. We need to get people back working. We need to get our children back in school, and that's the direction that we'll take. Yes, ma'am. Yes, I would say be persistent, number one, and be patient. We've had over 1.6 million Virginians. I'll repeat that, 1.6 million Virginians file for unemployment, and the great majority of them have received the benefits they need. Some of them have appealed the process. We've brought in adjudicators to address that. We're upgrading our computer systems, but we were literally inundated by the number of people, and nobody expected to see those numbers with the pandemic. We've learned a lot, but we'll continue to help people in any way we can. But I would ask them to be persistent and patient, and we'll do everything that we can to get their benefits to them. Yes.
Federal government giving you guys any guidance yet on booster shots or what else might be coming down the line for us after all this?
It's a great question, Henry, and we obviously know that variants are out there, and if the majority of the population doesn't get vaccinated, then those variants will continue to exist. Right now, we have not made any plans for booster shots, but we will continue to follow the science. We'll continue to follow the input from the President's COVID team, from Dr. Fauci, and do everything that we can to keep Virginians safe and healthy. But again, the chances of needing a booster shot will diminish significantly if everybody will get vaccinated. Yes, thank you all. Have a great day.